Well, the COVID-19 pandemic is in the rearview mirror for many countries, but the consensus that another pandemic could hit in the coming years is highlighting the need for a more sustained approach to preparedness. Health experts say that requires better financing and a reform of global governance. Well, for more, Shahida Othman joins us live from the Philanthropy Asia Summit here in Singapore. Shah.
Yeah, Teresa. Now, the big question is, how can critical players work together to form a more united response before the next big pandemic hits? What exactly is pandemic preparedness and what types of investments does it require? Now, I'm posing all of these questions to my next guest, Professor Katharina Hauck, Professor in Health Economics and Deputy Director at Jameel Institute of Imperial College London. Professor, we're so happy to have you here with us.
Pleasure.
Now, first of all, when COVID-19 first hit us in 2019, the world was obviously not prepared for it, despite our experiences with SARS, MERS, and Ebola. We saw gaping inequalities, such as unequal access to vaccines. We saw governments around the world implementing different measures. Up till today, what went wrong in the COVID-19 management and what lessons could we learn from it?
I think the world could hardly believe what hit it when COVID-19 struck. We just weren't ready for a disease of such severity and one that is so highly transmissible as well. What went wrong? I think Asia was in many ways better prepared because SARS left more of a memory, whereas European countries and the US, I think they just couldn't believe that the severity of the lockdown that we saw in China would be something that they would be implementing just a few months later as well. Yeah, so what could we do better next time? There isn't really an overarching international agency that has the mandate to impose country overarching policies. WHO, the World Health Organization, is there to give technical guidance and technical advice, but doesn't have the mandate from the countries to do this kind of work that would be really required. Now, we had the pandemic financing facility, which was meant to provide financing to countries who were not able to finance response themselves, but that didn't work very well for various reasons. What we need going forward is integrated data surveillance, data systems that can be shared very quickly between countries so that we know what's going on. And importantly, vaccine manufacturing and capabilities in the countries where they are needed most. And this is not only about technical equipment, but also about skilled labor and skilled workers who know how to produce these quite complex medical products.
How important, though, is an integrated modeling during a crisis like this?
Yes, so we have seen that really the economic and social impact of the pandemic was severe, and I think nobody quite expected that. So governments were looking to epidemiologists and public health experts to look at guidance on the deaths and on the potential hospitalizations caused by successive waves of the pandemic. But that the lockdowns and importantly the behavior change of individuals would have such severe economic impacts, I think nobody quite knew that. And we didn't have models that were able to advise policymakers on both the economic and the health impacts, how to navigate the trade-off between lives and livelihoods. That's something that unfortunately we could not advise policymakers on in a sufficient way.
So what role then can governments and philanthropists play in this whole picture?
Well, what we see that very often the government research councils in the country where I come from in the UK, but also in other countries, they're often focused, have a single discipline approach. Unfortunately, although they say that multidisciplinary research is required, we see that very often philanthropists who come from a business background understand that there are many voices that are providing advice, and they are used to marrying these advice that comes from many different disciplines in many different directions to decide on a strategy and a course of action. This is what we don't see so much in research, but we urgently need this. So partnering with philanthropists allows us really to get this philosophy into research projects.
Partnerships, that narrative has been playing throughout the whole morning here at the summit. Now, health experts, they have argued too that we've been so caught up on COVID-19 pandemic that we've neglected the other diseases such as tuberculosis, such as malaria and dengue. What's the gap left behind, and how do we ensure that funding on immunizations and treatments on these other infectious diseases is maintained in the event of another pandemic?
Yes, I mean, choices have to be made, and actually economics and health economics can advise us where our limited resources generate the greatest health benefit. As if you were investing in a company, if you're investing in population's health, you want to invest it where maximum health gain is achieved. Having said that, by investing into pandemic preparedness, we are investing into your health system capacity. And in peace times, if you so want, when there's no pandemic, this spare capacity will be to the benefit of other more endemic diseases such as the ones you mentioned.
I want to talk about the COVAX facility. I mean, equitable vaccines, it was set up to ensure that specifically, that we have equitable access to COVID-19 vaccines. Yet, if we look at official statistics, only 18% of the population in low-income countries are fully vaccinated, compared with 75% of wealthier nations. Could the program have been more successful?
Of course, with a stronger commitment by the wealthier or high-income nations to donate more vaccines via this facility, there would have been a higher coverage in low and middle-income countries. But the story is not that simple, because a vaccine is not a vaccination in people's arms. In order to provide vaccinations, you need a strong health system, you need the delivery, you need cold chains, you need staff on the ground everywhere in rural areas to deliver the vaccinations. That is something that some countries, some low-income countries, find very difficult to scale up.
Now, diverting our attention to the floods in Pakistan, I mean, we've been seeing widespread devastation, and now there are huge concerns over outbreaks of infectious diseases due to stagnant water. When we think of disaster preparedness, we always think about early warning systems or improved structural measures. But how can we prepare for outbreaks of waterborne diseases in these disaster-prone countries like Pakistan?
Yeah, so I think it's all about working with governments and communities to provide them very quickly with the equipment, the resources, but also the medical staff that is required to alleviate this. I mean, this is not possible without country engagement, but I think it would really help to have an overarching agency with a mandate and, importantly, the resources to deploy very quickly should disaster strike, whatever it might be.
Now, Professor, nearly 3 years on with COVID-19, we are seeing governments pulling back on their international response work. There is a sense of pandemic fatigue in the air. How do we overcome this to maintain the best of public health?
I think it's important to show decision makers in government that pandemic preparedness can have an incredible high return on investment. However, for some countries, actually, if you dive down into the details, it may not be worthwhile to invest into pandemic preparedness if they would be only seeing their own country. But we have to recognize that being prepared for pandemic is a public good. Viruses don't stop at borders. So for countries where it's not worthwhile to invest into being better prepared because there are too many other competing health priorities, the international community has to step in and provide this support for the benefit of all populations around the world.
Wonderful insights. Thank you so much, Professor Hauck. I was speaking there with Professor Katharina Hauck, Professor in Health Economics and Deputy Director at Jameel Institute of Imperial College London here at the Philanthropy Asia Summit.